Welcome to Medical Marijuana and Wellness. This is our Cannabis Snippets program to really help cannabis patients understand the various issues related to medical cannabis. And today, what we're going to discuss is why does cannabis affect individuals differently? And with me is my guest speaker, Amy Green. Amy, welcome.
Yeah, always wonderful to be here, Mark.
Great. You spend a lot of time in a clinic working with a lot of patients on how to use medical cannabis.
Absolutely. A big part of my job is helping patients create a program that's going to work for themselves and also being comfortable in going making purchases and just starting the whole cannabis journey.
Right. So you've seen a lot of the things we're going to talk about here. So let's jump right into it. I know the Cleveland Clinic gives some reasons why cannabis affects our bodies differently. Can you kind of expound on that?
Yeah, absolutely. So there are definitely a lot of different factors that go into how our body interacts with cannabis. This is going to be genetic factors, our individual biology, age, our sex assigned at birth, the method in which we are consuming cannabis, our tolerance and previous experiences with cannabis. And then if you're also taking any medications, that can also have some effects.
And these are a lot of factors of how our body processes things like food, alcohol, caffeine, and cannabis. It's not just unique to cannabis. So that's why a lot of the recommendations that are made when you're using cannabis is to start low and go slow, because our metabolism is really unique to every person. Tell us a little bit about that, because we have this thing called an endocannabinoid system, which affects, pain, anxiety, memory, appetite, inflammation, and our immune system. And this is really where cannabis is targeted.
Absolutely. Yeah. So we have two main receptors in our body that interact with cannabis. The first would be CB1 or cannabinoid receptor 1, and they are generally located in the spine, spinal cord, or I'm sorry, brain, spinal cord, and then some peripheral organs and tissues. And these receptors act like gates that open and close to control the levels and the activity of that receptor. Um, so that's just one way that cannabis is interacting with our body. The other type of receptor is a CB2 receptor. These are going to be mainly found on our white blood cells, tonsils, spleen, more internal organs. And these are going to help with controlling functions like our immune system and inflammation response in the body.
Now, CBD is particularly attracted to the CB2 receptors, which really affect things other than the endocannabinoid system.
Yeah, so CBD2 receptors can absolutely affect things other than the endocannabinoid system. CBD in itself is actually really interesting because it does interact with a lot of other receptors that THC does not react with. So, for example, CBD might also react with the 5-HT receptor, which is responsible for serotonin in our body and affects things like digestion, blood flow, breathing. It might also interact with the A2A receptor, which is responsible for inflammation and coronary circulation or blood circulation in our body. It might interact with the VR1, which is responsible for body temperature and pain, or it could also interact with our GRP55 receptor, which is responsible for blood pressure. So CBD actually has a lot of things that it reacts with in our body, not just the CB1 and CB2 receptors.
Yeah, and that's a really good point, that it has a lot of medicinal values. It's almost like a super vitamin that's really out there. Why does cannabis work so effectively?
Absolutely. So in our body, we have something called the endocannabinoid system. Endo meaning inside. So these are cannabinoids that our body is naturally producing. Now, the endocannabinoid system is what's directing a lot of the processes in our body, like our pain response, anxiety, memory, appetite, anti-inflammatory effects, and a lot of other immune responses in our body. Now, when we stimulate a cannabinoid receptors, our bodies produce molecules called endocannabinoids. Those are the ones that are inside our body. And they are very, very similar to the cannabinoids produced by the cannabis plant. Now, the molecules produced by the cannabis plant are what we call phytocannabinoids. And the consumption of cannabis introduces these phytocannabinoids into the body, which then stimulate those CB1, CB2 receptors in the same way that endocannabinoids, which are naturally occurring in our body, are reacting with our body as well. So,
And that's kind of interesting in that, and I'll take myself as a senior citizen, as I get older, my body's not producing as many endocannabinoids, and candidly, not as fast as it should sometimes to react to the stimulus that's being given to the brain. So in essence, by using phytocannabinoids, what I'm doing is I'm helping my body get the material it needs to stay in balance or stay in homeostasis. So if I do have an issue, I do have the material for the body to do its natural process, which is produce endocannabinoids and address that particular issue. So it's something that's very important because, again, if you have due to age or candidly due to an accident, like I had an auto accident where I had herniated discs in my neck, I needed help with the pain and I needed more endocannabinoids than my body was actually producing. So this is important to point out. That's why people need to use cannabis to really keep their body in homeostasis, avoid pain and inflammation. Let's talk about genetics because this is very fascinating.
It really is, yeah. So obviously, we all have a genetic makeup, and every person's genetic makeup is different than the other person's. That's what makes us all really unique. And some people have a higher density of CB1 receptors in their brain, making them sensitive to THC. Now, the CB1R is connected to the forebrain, which is actually the region most responsible for cognition. So, if patients do have a higher concentration of the CB1 receptors in the forebrain, that may contribute to more euphoria or more intense effects from the actual cannabis.
Sure.
And
And
then
this has to do with everybody's bodies being a little bit different.
absolutely, yeah. And then some people have a higher expression or more of the enzyme called cytochrome P45, and that's part of a super family of cytochromes enzymes. So that specific enzyme is involved in the metabolism of THC, and this can also affect the intensity and the duration of the euphoric effects that a patient may experience from the product.
Sure.
And yeah, and then compared to adults, adolescents effects or the effects of cannabis on an adolescent will be different than the effects that an adult experiences. And a lot of that has to do with the cognitive abilities of an adolescent brain versus an adult brain.
The University of Chicago has done a study on age and sex that's very fascinating. Can you explain it?
Yeah, so they found that related to age, that there are higher concentrations of one receptor in adolescence. That's the CB1R receptor, which is reflected in how they cognitively perform. Now, THC has no detectable effects on brain waves at rest in either adults or adolescents. Additionally, adolescents are affected differently by THC on cognitive tasks. Specifically, adolescents are more sensitive than adults to the acute behavioral and cognitive effects of THC, which that is actually supported by the National Institute of Health, and those are the specific studies that we reference there. This is why cannabis has positive effects on autism, ADHD, PTS, is because cannabis, again, is going to affect every person differently. And sometimes people with different brain chemistry, such as those with ADHD or autism, they may have a more positive effect versus other individuals that may have more of a negative effect, even though it's the same product, it's the same cannabis. You just have different effects depending on brain chemistry. Now, the levels of dopamine 1 is actually increased in adulthood, and that can affect tolerance as well, cannabis tolerance as well. And so we have to look at the opposite of that, is that adolescents would have lower levels of dopamine 1, which can absolutely affect their tolerance for cannabis as well.
Sure. And so these are actually factors of a body, of our metabolism. But I found in researching this a very interesting comment about really sex and studies. Can you kind of highlight that?
Absolutely. So it was not until 1993 in the United States that Congress mandated that women or females be included in clinical research studies. So a lot of our research that was done before that time was done only on the male body. So we have a great deal of information and knowledge about the male body, but our information and knowledge on the female body is significantly less. So we do have a significant research gap between the sexes. So we know, or we have a lot better idea of how cannabis affects the male body rather than the female body. Now, we have noticed that increased doses of THC have been observed to increase the bodily anxiety in women, yet they were not associated with subjective feelings of anxiety. To explain this, you might feel like your body is racing, but it doesn't make you feel anxious. It just feels like you're racing and you need to go someplace, but you're not feeling anxious by that. It's just a feeling that you have, but it's not contributing to anxiety.
Yeah. And this is very interesting. I was, I was unaware about how they didn't really have as much information on ladies as they did on men. And I think this is very, very important to understand. We're getting it now, but if there is a difference between the way a cannabis product affects a woman and a man, a lot of it is because we're really kind of learning about that right now. We're going where no cannabis users ever gone before. And some of it has to do with the consumption methods.
Certainly, yeah. So consumption methods, or what we generally call routes of administration, all this means is the different way that a person could consume the product. Now, generally, these are classified by A, where the substance is applied, or B, where the target action is. Now, for example, oral products, that's generally anything you're going to put into your mouth and swallow. So that's going to be your capsules, your edibles. Then you'll have products like sublingual products. Even though these are going into your mouth, they're actually meant to be applied under the tongue. That's why they're a little bit different than an oral product. Generally, we recommend that patients put it under their tongue, hold it there for a minute, swish it back and forth, and then swallow it. But again, it is based on where the product is actually applied, and so that's why it's a little bit different than an oral product. And then you have inhalation products. These are going directly to the lungs. This is going to be things like flower inhalers, vapes, concentrates. These are generally going to be stronger products, and they generally have a very fast onset time. And then you have topical products, generally applied to the skin, and they are meant to be either a local product, so you put it on your knee, it just helps your knee, or you also have some that are transdermal and will help wherever you put it, but then go through your skin and into your bloodstream and just give you a low level of medication throughout your whole body.
Mhm.
Now, I do have a note on dosing here. Dosing is very individualized. The dose that works for one person is not guaranteed to work for another person. And that's why we always say start low and go slow. Because again, your friend that is using 2 gummies to help them sleep at night, that may be a very inappropriate dose for a new patient that perhaps needs to start with a quarter or a half of a gummy to have the same exact effects. So what works for one person is definitely not guaranteed to work for another person.
And I think a good point to that is that I know that I read a study recently that right now gummies and inhalation are the top two ways people are using medical cannabis. But I think it's important to point out that oral product that you're taking that gets absorbed in the stomach, it could take anywhere from 30 minutes to 2 hours to work.
Mm.
And will last between 4 to 10 hours. It lasts a long time. So one of the things about oral products is you got to really be cool, because as opposed to like sublinguals, which take 15 to 30 minutes to work, or inhalation that works immediately, one of the things you don't want to do with an oral product, some brownies or gummies or whatever, is take one, wait 15 minutes, it's not working, so take another one. And then what's going to happen is you're going to end up taking twice as much as you normally can have. And again, this will affect how cannabis affects your body and the outcome that you're looking for. So let's talk a little bit about the psychological side of this, because some use of cannabis really is influenced by both your setting and the time of day.
Absolutely. I usually call this set and setting. So your set is your mindset going into the using the product, and then your setting is where you physically are. So setting and company, you just really want to be in a comfortable, familiar setting, especially if you're using a product for the first time. You just want to have somebody there that you can trust, and hopefully that is going to increase the likelihood of having positive effects from it. Conversely, consuming cannabis in an unfamiliar or stressful environment can absolutely increase the adverse effects. So, especially if you're using it for the first time, we would never recommend taking a product for the first time and then going to like a rock concert. You're going to have a bad time. Same thing with time of day and planned activities. Set aside some time when you take a product, one, to see how you'll feel while you're using it, but two, give yourself things that you like to do while you're using that product. So it might be listening to your favorite radio station, or watching a movie that you love, or even socializing with people that are very familiar with you. As you're going through this experience, all of those can contribute to having a positive experience. And then conversely, stressful tasks can absolutely lead to more negative experiences, such as, you have a, gosh, like you have a very heated phone call with somebody as you're using the product. That may absolutely affect the mindset that you have at that moment and turn it from more of a positive experience to more of a negative experience just because of the input that's coming into your body.
Sure. I know that there are times with, I know that a lot of folks, I would have a deadline that would come up. And they'd maybe use some cannabis to be able to try to get more focus and find out that because they had this deadline that really was taking over their body, the dread of not making that deadline caused that negative cannabis experience rather than letting the cannabis help you be able to focus and be able to get the job done. So your mental state really has a lot to do with it. Again, time of day and also stressful events can have something to affect that as well. Tolerance and experience really has an effect on how cannabis and your cannabis experience uh, produces the results that you're either looking for or not looking for.
Yeah, absolutely. So tolerance, it's just how you're reacting to a certain dose. Some individuals may have a very high tolerance, some may have a very low tolerance for cannabis use. It's very much based on your body chemistry, how much you use, how much you've previously used, along with if you've eaten, if you're very tired. A lot of things have effects on your tolerance.
Sure. I know that, and let's talk a little bit about what they call tolerance breaks, because a lot of folks that I run into that say cannabis isn't working for me anymore, when I ask them when was the last time you took a break or a holiday, they really haven't. And what happens is your body does build up a bit of a resistance to cannabis. By taking between 1 to 4 days off, what happens is your body then resets. Your endocannabinoid system says, wait a minute, I'm not going to be getting help from the outside. I've got to kick in and start working again. My holiday is over, and it starts kicking in and start working again. I know in my case, I have 7 herniated discs in my neck, and I can go between 1 to 1.5 days with a tolerance break, and then my neck taps my body, my shoulder, and says, "Hey, better do something. Or you're going to know I'm here." But the point I'm making is that when I finish that tolerance break after that day and a half, I use less cannabis, and it's more effective because my body has reset. And I think that's something that people need to pay attention to be able to continually use, not only use cannabis effectively, but use less of it or basically save money.
Absolutely. Another thing is experienced users may not feel the same intensity or effects as beginners. Take, for example, the person that's using 2 gummies. That may be a tolerable and appropriate dose for a more experienced cannabis user. But
Mhm.
for a beginner, that dose may be entirely too high, and it may be a very negative experience for them if they were to take that dose. Whereas
Sure.
something like a quarter or a half of a gummy may be a more appropriate dose for that beginner to start at.
Now, your experience has a lot to do with it too, because I mean, if you've used it before, you kind of know what you're getting into, where a new user is apprehensive about the experience.
Absolutely. So those that have had previous positive experiences generally have a more favorable reaction to using cannabis. While those just the opposite have had a more negative experience, they're going to have a more negative perception going into the experience, and that can have the effect of possibly producing negative effects. So just your negative experience leads into your next negative experience,
Mhm.
whereas you could kind of change your setting and give yourself the best possible chance of having a more positive experience.
And that's a good point that we make. There's also a lot of medical considerations that have to do with cannabis.
Yeah, absolutely. So cannabis can make some medications either more or less effective. Now, for people taking hormones, whether it be a birth control or a hormone replacement, some people may experience differences in how the cannabis is affecting them as their hormone levels fluctuate in their body. So they may have a more positive or a more negative experience just depending on their hormone levels at that time. Additionally, this is a really big one, anticoagulants. So cannabis may make Coumadin, also known as warfarin, more effective. We always recommend talk to your healthcare provider if you are using Coumadin or warfarin while using cannabis. And then we always recommend that you talk to your healthcare provider about all of the medications that you're taking, including cannabis. Even though cannabis, you're either smoking it or you're taking a gummy, you might take a capsule. It's not a traditional way that we would normally think about medications, but you really do have to tell your physician, hey, your physician or your provider, hey, I'm using cannabis as a medication. I just want you to know so that you might know about any potential interactions that might happen. And then, of course, cannabis may intensify the effects of alcohol. So if a person does want to use cannabis and alcohol, I really always recommend drop down your cannabis dose and then slowly increase it again to find that spot where you're comfortable. Otherwise, you may have more intense effects from the alcohol that make it very uncomfortable.
Sure. And that's a good point, Amy, because I've been with people who have used cannabis and alcohol, and I've seen that candidly the cannabis will intensify the effects of alcohol somewhere between 5 to 20%. Again, that's all studies that are out there with different studies that are there, but it doesn't it affect the intensity of it, and that's what you got to be careful about.
Absolutely. And then finally, you do have the placebo effect. Just like if somebody were to take a sugar pill and they think that they're taking a real medication that's going to help them, cannabis can have that same effect where you believe or expect that it will help you, or it will help you relax. It might help with pain. And that belief can then turn into it having those effects on your body, even though it might not be producing or it might not have any actual potency to it.
That placebo effect is interesting because your mind is a very powerful tool with respect to controlling your body. So, Amy, let's summarize this because there are a number of factors. We've tried to explain why these factors come into play, but cannabis will affect you differently depending, again, on your genetics, your biology, psychology, and your environment. What's our next steps?
Absolutely. So it's really listening to your body, taking that inventory of how it's making you feel. Is it a positive experience? Is it a negative experience? What you could change in the future to make it a more positive experience. Of course, we are always going to recommend starting at the lowest possible dose and then slowly increasing your dose to find that spot where you're comfortable without unwanted side effects. And more than anything, it's listening to your body. Your body will tell you what an appropriate dose is. If you feel that the previous dose you took was a bit too much, then your body's telling you, hey, that's too much. We need to cut back next time. And then after you take that next dose and you cut back, reassess how that made you feel. It's completely based on how you feel using the products.
Right. And that's important because a lot of folks will ask, well, what should I take? And I think that's used to the pharma driven world where the doctor says, take 2 pills and see me in the morning. Spoiler effect. The reason the doctor says take 2 pills and see me in the morning is because he's giving you the minimum recommendation for that particular drug that he's giving you. And if it doesn't work, you have to call the doctor back and get your prescription adjusted. The nice part about cannabis is if you start with the lowest effect, again, going low and starting low and going slow, your body will tell you how you feel. And I cannot emphasize that more. You're in control, but listen to your body. That's a very important part of the whole cannabis experience. Amy, any last thoughts?
No, just of course, I always recommend keeping a treatment journal. It's a great way to be reflective about the products that you're using and really look at their effect on your body. Are you experiencing more negative or positive effects from that product? And then, of course, start low, go slow. And if you have questions, ask questions.
And I should point out, if you like this video, please subscribe and like the video on YouTube. And if you are interested in learning more about medical cannabis, not only follow us on social media, and of course, we do weekly webinars with Marijuana Aware with a number of different topics that are out there. Thank you very much for joining us, and we hope that we can help you get your life back.